Smile design. Smile design, consider the word smiles as an acronym. I for inclination, L for lip line, E for extra hard tissue, I'll explain each and every aspect, and S for soft tissue. So if you consider this, and if you understand exactly what each and everything means, you can definitely carry out a good smile design for any patient, and provided you can play with colors. Okay, it's very, very simple. That's why I said playing with colors, make it a habit from tomorrow. Of course, we all know that the squarish or rounded or pointed, etc. We all know that there is a difference between the masculine and the feminine teeth. Okay. Now, when you talk about a lateral incisor is going to be slightly dainty, darling, as far as the females are concerned. You're going to have give nice rounded ones. Men, you can give it a squarish one. But if you give me a canine which is going to be more rounded and not very aggressive, probably I'll look like a feminine. The same way, you also have to understand the age of the patient. You cannot go and create a mamelon for a person of my age. Okay, I'm 29. Okay, you still can't give it to me. Okay, I'm 29 in practice here. People conclude things before I even finish. Okay, don't allow me to complete my sentence. I didn't say I'm 29 years old. What I'm saying is, you have to look at it. You have to have a guy who walks in at the age of about maybe 13 or 12, and if his incisor edges are broken, don't give him a flat surface there. You're doing wrong, injustice to that guy. You have to create those mamelons for the patient. Okay, so you have to do whatever has to be done. You can't give that guy a darker shade. At the same time, you can't go and give an old man good mamelons around that area and make him look like a... You can't do that. Okay, so these are certain things which you have to see and which you have to understand, whether it's feminine, whether aged guy, whether young guy, masculine, weak guy, whatever it is. Accordingly, you go ahead and do the needful as far as the patient is concerned. Again, Miller's rule, when you talk about your 5:4, that is length is to width. So you have to measure that rule. You look at the golden proportion. The golden proportion is simple. This is what I do. I put a paper over there. I just draw. And then I go ahead and measure. I know that if the lateral incisor is 1 mm, my central incisor should be 1.618 times that of the lateral incisor. So generally lateral incisor is 5 mm. My central incisor is going to be 1.6 of 5. That's going to be 8 mm. And same thing is with canine. You're talking only from the incisor, the tip of the canine to the mesio-incisal angle. And that's going to be 0.618 times that of the lateral. So accordingly, you have to work out a strategy and tell the patient, listen, with the midline. It is not necessary that the midline of the face will coincide with the midline orthodontist. So how many times can we really do it? Sometimes we may not be in a position to do it, but still it may not be incisal inclination. It's not straight. You have to realize that there is a slight inclination, axial inclination of the tooth. So you have to give it that in order to give that kind of makeup over there in that patient's mouth. Again, lip line, whether the patient has got a high lip, whether the patient has got a low lip line, and where are the incisor edges, are they running along the curvature of the lower lip. These are certain things which you have to see. That's why one of the L's of the smiles, basically. Okay. Now, E is actually the extra hard tissue guidelines. Now, you know the contact area. As you go between the central incisor to the lateral, it will go more cervically. And from lateral to the canine, it will go still more cervically. It's like a step. Okay. Now, you also have to realize that if suppose the patient says, multiple diastema, I will not agree. Then what do? You take the contact area slightly more palate. That doesn't mean that you intrude into the palate, but the fact is that you take it, you give it more contour in that area, take the contact area more palatal, even though the tooth actually is widened by you, violated the Miller's principle, but still it doesn't look all that bad. This is just playing with the contour of the tooth. Like you play, like illusion can be brought about by changing the color or by changing or modifying the contour of the tooth. So this is one of the way of doing illusion, by taking the contact area slightly more palatal, okay? Or you can even do one thing, that's how you change the contact area by taking it. That's the extra hard tissue guidelines. Extra hard tissue guidelines is nothing but contact area. Again, soft tissue guidelines, your gummy smile. Okay, the patient has got gummy smile, go ahead and work on that particular area. Or sometimes the patient shows teeth which has got what you call it as longish teeth, but same time bad gums, whatever the case is. So you have to work on that. So that's how the smile design, what you look out for is the acronym SMILE. Understand that acronym SMILE, understand each and every aspect of it, your life becomes much more simpler.